Hello everyone. Today I would like to talk about extraoral radiography. I've really tried to make this topic as simple as I can and I hope it helps. Okay, so extraoral radiography. First, I would like to talk about are the planes. First plane that is important to us is the canthomietal plane. That extends from the canthus of the eye to the external auditory meatus. Next is the Frankfurt horizontal plane that extends from the lower border of the orbit, also called as orbitale, to the porion. Now the angle between these two planes is 10 degrees. So there is 10 degree of angulation between the canthomietal plane and the Frankfurt horizontal plane. This angle is 10 degrees. Now, the first projection we're going to talk about is the lateral cephalometric projection. This is the lateral cephalometric projection where we can see the lateral profile in the radiograph. Okay, so this is the image receptor, this is the patient, this is the X-ray tube. Image receptor is placed such that it is parallel to the sagittal plane and the beam is directed perpendicular to the image receptor along the external auditory meatus. So, image receptor parallel to sagittal plane, beam perpendicular to film along the external auditory meatus. Now the structures that are closer to the image receptor are less magnified in the radiograph, whereas the structures that are away from the image receptor are more magnified. Now it is best prescribed to view nasal bone fractures. To view the nasal bone fractures, we prescribe the lateral cephalometric projection. Okay, so the next projection is a submentovertex. Submentovertex, where we can see the base of the skull. This is the alveolar arch. We got the mandible, we got the condyle. So this is the submentovertex projection. Okay, so the image receptor is placed parallel to the Frankfurt horizontal plane and perpendicular to the coronal and the sagittal plane. The beam is directed, as the name suggests, submentovertex projection. So the beam is directed from below the mandible to the vertex of the skull and such that it is 2 cm anterior to the condyle. So image receptor is placed parallel to FH, perpendicular to coronal and sagittal. Beam is directed from below the mandible 2 cm anterior to the condyle, perpendicular to the film. As I told earlier, we can clearly see the base of the skull in this projection. Another variant of submentovertex is the jug handle view, which is nothing but an underexposed submentovertex. As you can see, it is completely white or radio opaque. Now it is used to view the zygomatic arches to see if there are any fractures or whether it's displaced or not. So we prescribe jug handle view to view zygomatic arches. Okay, so we have talked about submentovertex, we have talked about lateral cephalometric projection. Next is the oblique lateral of the body of the mandible. As you can see, as the name says, it's an oblique projection where we can clearly see the body of the mandible. Okay, so the patient is positioned with her head tilted to the side that needs to be viewed, and this is the image receptor. Image receptor is placed over the premolar and molar area such that it is the inferior border of the image receptor is 2 cm below the inferior border of the mandible. So head tilted, placed over premolar molar area, 2 cm below the inferior border of the mandible. This is the X-ray tube and the beam is directed 2 centimeter below the angle. This is the angle of the mandible. It is directed 2 centimeter below to record the premolar molar area of the other side. Okay, so that was oblique lateral of the body. This is the oblique lateral of the ramus. As you can clearly see, we got the ramus of the mandible, we got the condyle, we got the coronoid, we got the mandibular canal. So this is oblique lateral ramus. It is similar to the oblique lateral body. The patient's head is tilted, image receptor is placed, the patient's head is tilted such that the angle of the opposite side and the condyle of the side that needs to be viewed are in the same plane. So, angle of this side and condyle of the other side are in the same plane. The image receptor is placed over the ramus and the beam is directed 2 cm below the angle. Head tilted, angle, condyle same plane, image receptor positioned over ramus, beam 2 cm below angle. This is the oblique lateral ramus, where we can clearly see, as I told earlier, condyle, ramus and the angle of the mandible. Next is the Waters view. So in this, the patient is positioned such that the chin touches the image receptor and the canthometal line, this is the canthometal line, forms an angle of 37 degree with the image receptor, and the image receptor is perpendicular to the sagittal plane. So the sagittal plane and the image receptor are in two different planes that are perpendicular to each other. We got the canthometal line 37 degree, chin, only the chin is touching. And the beam is directed perpendicular to the film and directed along the maxillary sinus. So this was the Waters view. In this we can clearly see, it is the best radiograph to view the maxillary sinus. This is the maxillary sinus, we got the frontal sinus here. We can clearly see zygoma and we can clearly diagnose zygomatic fractures through this radiograph, and even the Lefort fracture lines can be clearly delineated in this radiograph. Next is the posterior anterior view, also known as the PA view. As the name suggests, it is directed from posterior to the anterior of the face. So, patient is positioned such that only the nose touches the image receptor. The image receptor is positioned perpendicular to the Frankfurt horizontal plane. This is the Frankfurt horizontal plane. Perpendicular is the image receptor, and the beam is directed perpendicular to the film directed along the bridge of the nose. So that was all about PA. Next, we got the reverse Towne's view. In reverse Towne's view, only the forehead is touching the image receptor. The image receptor is perpendicular to the sagittal plane, and the canthometal line forms an angle of minus 30 degree with the image receptor. The beam is directed perpendicular to the film along the condyle of the mandible. So, image receptor perpendicular to sagittal, minus 30 degree with the canthometal line, beam is along the condyle. This radiograph is prescribed when we have to view the condyle and its fractures. This is the condyle. Okay, to recapitulate, we got the Waters view, the PA view, the posterior anterior view and the reverse Towne. In Waters view, the chin is touching. In PA, nose is touching the image receptor, whereas in reverse Towne, the forehead is touching the image receptor. And I forgot to mention one point of reverse Towne, that it is an open mouth projection. As you can see, in these two, the mouth is closed, whereas in this, it is the mouth is open. And the image receptor is positioned such that it forms an angle of 37 degree with a canthometer line. In PA, image receptor is positioned perpendicular to FH plane. In reverse Towne, the canthometer line forms an angle of -30. So, chin, nose, forehead, 37 degree perpendicular to FH, -30 degree canthometer line. The beam is directed along the maxillary sinus in Waters view. It is directed along the bridge of the nose in the PA view, and it is directed along the condyle in reverse Towne's view. So that was all about extraoral radiography, and I hoped this video helped. Okay, thank you so much for watching my video.